of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thanks for all for attending and for watching on television this evening. A couple of just opening words, just congratulations to Villanova and the great basketball season, and also a great thanks to the Township for making it a safe and wonderful celebratory environment in the Township. I think it was a real tribute to how things were organized, how well it went, and how smooth it went, and we're proud to be a member of the Township after seeing that great celebration. So, excellent job, everybody. I did send the March minutes out to everyone. If anybody had a chance to review them, I think I sent them in the email. Was there any additions or subtractions anybody had for the minutes from last month? No, nothing. Okay. So we can, if someone would move to approve the minutes from last month. So moved. Any second? There's a second. And all of those in favor of the minutes being approved and being posted, aye. Aye. Any nays? None. So minutes are approved and will be posted on the website. Okay. And we'll move on. Mr. Taltone, can we go on with the health officer's report, please? Thanks.
Good afternoon to the Board of Health members. This is a report for March 2016. We did 18 food safety inspections, 11 bathing place inspection, 3 interviews for assistant health inspector. 2 candidates were submitted to the administration for consideration. We had 10 quality of life issues. 1 where we had a dog that was being dog set that bit the sitter. He was current with his rabies vaccine. We had 1 that bit a person that was visiting a home. That one also was current with his rabies vaccine. We had a fire on a roof on the restaurant. That restaurant is still closed as we speak, under renovation. We had an unsanitary condition in an apartment building where there was a young child left alone. That's under litigation. We had another property that was unsanitary. We had to step up and increase the level of enforcement. That property is now cleaned up. We had another situation where there was a dry vet that was improperly discharging from an apartment window. That's been removed. We had a restaurant where we had the smell of gas leaching into the restaurant. That restaurant is currently in transition, I would say. We had a complaint where a resident that was on public water, they weren't on a well, that was complaining of yellow colored water coming out of their faucet. We got Aqua Pennsylvania involved in that. They flushed the hydrants, did some testing, and that problem has been resolved. And we had an unfortunate situation where there was a challenged child in a restaurant that had an accident, and it was properly cleaned up, but there was a little bit of a problem with some people had with it. So that's been resolved. We currently have, under facilities open or soon to open, Big A restaurant that's down on Glenbrook, 810 Glenbrook. I thought they would have probably been open today, but they have a couple of other tickler items that need to be corrected, so they should probably be open next week sometime. Since this report, the Little Basil restaurant, 906 Conestoga, has opened. It is open. Well, it's been approved to open up, to do business, but they've been given the okay to go ahead. The other 3, Autograph Brazier, they're still under renovation. First Watch, they're still under renovation. And Starbucks Coffee, they're open. This is the one down in Villanova. And we had 2 health advisories. Advisory number 331, Shigella outbreak, and 332 was update CDC recommendations on timing of pregnancy after Zika exposure and prevention of sexual transmission. Under temporary events, one that's not listed is the Katie Sampson lacrosse tournament, which is actually Saturday. So that's a very nice event. So if anyone has a little time on Saturday, you might want to come out and enjoy yourself. That's at the Radnor High School. So ends my report.
Thank you very much, Mr. Tatone. I appreciate that. Obviously, a lot of other matters going on, except, other than restaurant inspections, and I'm hoping that we can get you some assistance soon. Just some old business. I'm not sure we can do a whole lot with the artificial turf safety that we had spoken of, or the neutered neutered dogs, neutered dogs in the parks recommendations the board was going to make. The two members who are working on those recommendations are not here this evening with us. I do think that, and I keep saying this every month, that we should communicate by email to try to have a statement ready for our recommendations on these two issues in the ensuing weeks between meetings, and I'll take some fault for that, for not sort of taking the lead on that. But I'm going to ask Amy and also to help us out with that, with the fields and our recommendations on what to do for that. I know that we've looked into how the fields are maintained and when they were put in, and we know that they're relatively safe, but we do want to try to make some recommendations to keep it as clean for our kids as possible, and also as safe as we possibly can. Mr. Dooling had mentioned a few months ago, rather, that we would like anybody who has any interest in presenting on Radnor Health Matters, the television show on our local cable network, to please feel free to think of some subject that would be interesting for the public to have a 20-minute or 30-minute discussion about. I'm currently in the process of trying to put together one with an infectious disease physician in the mainland health system, speaking about Zika virus and other summer illnesses, including Lyme disease and possibly West Nile virus. So I'm hoping to have something in May for that. So if anybody has any ideas, please either get in touch with myself or with Mr. Dooling to schedule a time where we can go into the studio and record one of those episodes for Radnor Health Matters.
Dr. Foreman, this is off the cuff, but is this open to other medical professionals in the township that they may be interested in, or the police, or they could do something?
I think so. I think this is going to be something that's it's been, service to the community. If it's reviewed and looked at, and it seems like a subject that would be of interest and help to the community, I think it's a great idea. If anybody else is interested in the community of, putting together, like I said, a 20-minute or 30-minute, interesting subject for people to hear about, discuss on the news, that'd be great. Oh, good. And Joan has just arrived as well. Had you put together anything about the dogs or some recommendations for the board? I hate to put you on the spot when you get here.
That's okay. So my feeling on this is that we do not act on instituting signage or trying to institute signage until we know to what extent it's a problem, not the idea of not fixing something that's not broken. My sense is most people in this area probably neuter their dogs, spay neuter their dogs. I encounter some not spaying, neutering where I work, which is not right around here. But I think I spoke with Animal Control Officer Bill Gallagher to get some of these numbers. And it's the gender of dogs involved in inter-dog aggression incidents is not recorded. The spay-neuter status is not recorded. What is recorded is rabies vaccination status. There have been about 7 incidences of dog fights, inter-dog aggression, at Hartford in 2015. But it's possible that the actual number of incidences that go unreported could be, 5 times that amount. That's something that would be not possible to know for sure. So what we would need to do, I think we should get a better handle on the actual incidents and if this is a problem in the township and to what extent it is. What would have to be done is a procedure change would have to be initiated so that, and that's through the police department, so that Bill, as well as the police officer, so it's Bill Gallagher, as well as the police officers who take these reports, that they would include in the information the gender and spay-neuter status of animals of dogs involved in these incidences. So we could do that. The other option is we could reach out to the vets in the area, and I'd be happy to do that, to see if they have any estimate of, I'm sure they don't keep this as information, but, they see the results of dog fights that may or may not be reported, and maybe they have some sense of that. I know I have a sense of it where I work. Obviously, I don't keep numbers, but I have a sense of it. Oftentimes, the victim that comes in is the one that is actually not neutered, is an unneutered male, and I kind of give the owners the lecture, and from time to time they do know the status of the other dog. Often not, but sometimes they do. So,
Just out of curiosity for a dog owner, are there signs that we would look for as a dog owner that another dog, is either scoping my dog or in, their behavior has changed? Is there something that you can say as a vet that I would be a little bit more concerned by?
Yeah, I would I would keep my dog away from any dog that looks reactive. Now, I saw one just the other day actually at Hartford, and I could tell from across the way that without seeing that the dog wasn't neutered, just by how it was moving, it was humping other dogs. It wasn't showing aggression, but if a dog humps another dog, that's the start of trouble, because the other dog might react and then bite it out of, fear, and then which is the dog that was the aggressor? It doesn't matter. The problem was that you've got a dog that's acting reactive and acting, I guess you could call it sexual, but it is sort of a testosterone behavior, and that can precipitate a problem. So those are things that you would look for. Very barky dogs. Dogs that are not neutered tend to be just they have a reactivity that absolutely changes from when they're not neutered to when they're neutered. It changes, and I promise people all the time that they will see a change, not in the dog's personality, but the dog will be a better pet, less reactive, not barking at everything, not lifting their leg at every single bush to urinate, not humping people's legs, not humping other dogs. That all decreases significantly. So I think people should keep their dogs away from dogs that display those behaviors. It's asking for trouble.
I guess we're certainly in the prime time of people going to the parks with their dogs this time of year, so I certainly would appreciate if you just keep an eye on statistics, talking to vets in the area and see if there's really anything we should do or shouldn't do as a board.
And do we want to ask the police department, the lieutenant, to institute a procedure that they would add this other piece of information when they take a report? That's something that would have to be a formal procedure change.
It seems like a relatively easy thing to ask a person when they report an incident of a dog that's been attacked or attacking. I don't know how easy it's going to be to make that move, but it would be certainly helpful. Yeah, thank you.
Okay.
I appreciate that. Okay. Any other old business anybody has any information on? No? Okay, so just one last thing. I think next month, Shana's going to present something about opioids. Is that correct?
Yes, so I got together an outline regarding I found some national and local statistics on opioid use. I was going to talk a little bit about the history and how we got to where we are. There's a lot on the CDC website, which is an incredible source of information regarding physicians and some new guidelines for chronic pain, prescribing practices to hopefully avoid this kind of addiction. And I did reach out to Andy Block, Officer Andy Block, and he's going to be co-presenting with me to talk a little bit about the community and what's going on. So I'd be happy to send out an outline. I didn't bring it with me tonight, but I could send it out to the board to get some feedback or any more suggestions.
I think this, I mean, in addition to your presentation next week, I think next month this will be an ongoing discussion. It seems to really have taken the center stage in the national news front, opioids, and they'll bring us to new business here. If everybody is aware, the state of Pennsylvania has recently made Narcan, naloxone, which is the reversing agent for opioids, which includes heroin and also includes the oral opioids, which are legal medications prescribed by physicians, and is really a life-saving medication. But Governor Wolf has made it available for, and the legislature of Pennsylvania has made it available for it to be used in schools and be available in schools for use, and of course, to be available to EMTs and police officers across the state to save lives. So just for everybody's information, this company called Adept Pharma has offered free boxes, or free kits of naloxone to be used in schools in Pennsylvania, and also educational and training materials for them to use as well. It's been spearheaded by the Clinton Foundation to literally just save lives. CPR can be administered to someone on high doses of opioids, only to maintain their life until the opioids are reversed in their body. And if naloxone is administered right away, these people can be saved immediately without having to administer CPR. There's a few things that need to be done if our school district decides to have this medication available at our schools. And one is the school needs to have a standing order from a school physician that it can be administered to someone who they suspect has had an opioid overdose. There has to be a specific policy adopted by the school board with a specific addendum to the school drug administration policy. So again, this is something the school board would have to probably pass. And there's also a statement that has to be presented to the state that the school nurse has completed a Pennsylvania approved training in Narcan use. So if those three criteria are met, the school can get that free naloxone to be available for life-saving, hopefully life-saving emergencies. So I think I don't see the downsides of it, and I'm not experienced as a pediatrician in the use of it, but certainly all of my reading says that it is a safe product, and when used properly, is a life-saving medication. So I'm not sure there's a downside to it, but I think that coming from our board, maybe at the next meeting, we can either make a formal statement that says we feel like that's the case, that we think it should be reviewed. And Mr. Taltone was nice enough to contact, or Kevin Kane may have contacted you, I'm not sure how this worked, but he sent an email that said that the school is, did I give that to you? Yep. So, Mr. Kane, who's the representative from the school on the Board of Health, who couldn't be here tonight, said that the district is aware of the efforts in the Commonwealth and is talking to get Narcan in the schools. We are actively exploring it as part of our comprehensive planning process. So I think that maybe it will be a bit of a push if we kind of also give our recommendation that we should move forward on this as well as a helpful thing.
Dr. Foreman, the information that you just gave regarding the training in the schools, will you send that to Kevin Kane so that he can pass that along? I think it'd be wise if a small township like Radnor, if we're having the police next month, and before the school year ends, the school board could in fact it takes so long for bureaucracies to get things going. And then you also have the other issue of the school nurse, if in fact she is part of the PCERS, and if that will be problematic, administering. So at least we will be giving them time to get all their ducks in a row. So if you send that, and copy maybe a school board member, because Dr. Kelly's leaving. So it'll fall in the hands of a new, and the commissioners, because we're having the police here, and that's under their jurisdiction. So, thank you.
And in addition, we are a very small township, and the high school and the middle school are very close to the stations. And I know that the EMTs obviously have that on board immediately as well. But I think that doesn't completely make it safe. I think it's good to have it on the scene, as we should all have AEDs and other things to save lives as well. So I think it's a great idea. Just to let everybody know about influenza activity in the country is still in a slightly elevated state, but falling each month, or each week, I should say. And in our region, it's been falling as well, with less cases in laboratory confirmed cases in the last 2 weeks, with a peak earlier or late in March and early in April. This year's flu vaccine was about 60% effective, which is a pretty good year for the flu vaccine, and it was a milder flu season. That's hard to say if that's due to just the regular sort of drifting and shifting of the flu virus, or this is a good match on the flu vaccine and enough people were vaccinated to keep the burden low in the country. There were 50 reported deaths this year of pediatric patients from flu. That's a low for the last few years. Usually ranges in the 150 to 200 deaths per flu season. The flu season's not over yet, so I shouldn't say anything yet, but that's a better season than last year. So, any other new business anybody has? Any other issues? Okay. I do think that we were going to, at the last meeting, look at a clip of the publicity from the Teen Health Week.
Yes, and I believe Ian's going to come out and run that. It runs about 7 minutes. The audio is difficult to hear, but it's to show you, the Board of Health, and any public how much press it actually did get for all around the state for its first year. So thank you, Ian.
This week, Guthrie Health Systems are celebrating Teen Health Week.
That's right. It's geared to help educate teenagers about the importance of looking after their own health. WENY's Isabel Garcia joins us in the studio with some takeaway points teens should be paying attention to regarding their overall health. Good morning, Isabel.
For the first time, the Pennsylvania State Health Department is labeling this week Teen Health Week. Emily DeVito visited Guthrie and explains what health issue the state is focusing on.
Candace, the Pennsylvania State Health Department says teenagers make up one of the largest portion of the world's population. And the department feels that between the ages of 13 and 19, teenagers have a specific set of health needs and are most impressionable.
It's day 5 in our Pennsylvania Teen Health Week roundtable discussion. And today's
one of the reasons I became a physician was to serve teenagers. That's one of the reasons I did internal medicine and pediatrics, because I wanted to make sure that not only were teens healthy while they were teens, but how could we help them become healthy adults? And I think Dr. Ahmed and really the Philadelphia College of Physicians really gets it, and I'm really excited that the Pennsylvania Department of Health could join with you all to celebrate Teen Health Week, the first Teen Health Week.
I wanted to share a couple observations that occurred to me as we've been sitting here watching 2 historic events unfold in parallel. One of them is the blizzard of 2016, and the second is the first ever Pennsylvania Teen Health Week.
Week is simply meant to be a starting point for young adults to take ownership of their own well-being.
Doctors are emphasizing how critical it is for teenagers to strive to be healthy during such a crucial time in their life. This includes maintaining a healthy diet, addressing mental health issues, substance abuse, and sexual health.
The Pennsylvania Youth Survey is conducted every 2 years. Among its latest findings, nearly 1/3 of students reported feeling depressed or sad most days. And as far as healthy eating goes, PA Health Department found more than 1/4 of youth in PA are overweight or obese. It also found only about 1 in 4 students obtained the recommended 60 minutes of exercise daily. Health experts say this week is about teaching teens to make choices for the future, not for the here and now.
Whereas more than 7%, 1.7 million of people in Pennsylvania are adolescents between the ages of 10 and 19, and
whereas adolescent health encompasses a broad spectrum including but not limited to diet, exercise, sleep, interpersonal relationships, mental health, sexual health, and substance abuse.
Whereas in recent years, less than half of Pennsylvania high school students report getting the recommended amount of daily physical activity, 20% had at least one chronic health condition, and 13% report seriously considering a suicide attempt. And
whereas health behavior patterns established during adolescence affect an individual's current and future physical and mental health, and
whereas emphasizing strong health literacy skills in adolescence can produce social, financial, and economic benefits, resulting in individuals who are better equipped to manage their own health, as well as their families, reduce health care costs, and healthier and more productive workforce. And
whereas the Pennsylvania Department of Health, in cooperation with medical professionals, educators, parents, and advocates, is committed to promoting healthy lifestyles, preventing injury and disease, and ensuring the safe delivery of quality health care.
Therefore, I, Tom Wolf, Governor of the Commonwealth of Pennsylvania, do hereby proclaim January 25th to 29th, 2016 as Teen Health Week. I encourage all Pennsylvanians to recognize the value and importance of adolescent health.
Good stuff. We'll be looking forward to Teen Health Week next year and hopefully be able to get the board involved quickly so we can, obviously contribute and make it a more successful, even better event next year and hopefully include some more people in the community. That's great. Just a few announcements. I think that last year we had made an attempt as a board to try to be at some events and ask the public at these events by sitting at a table as a Board of Health member to see if anyone had suggestions for what we would do as a board or what we could help the community with as a Board of Health. I don't recall there being too much input at these events, and Amy had said that she had been at a few and just, no one came up to her and said anything. But I think that we have 3 good opportunities coming up in the next couple of months that might be, if anyone's planning on attending and wants to sit at a small table and just, ask the public and have a sign up that says that we're from the Board of Health, would you have any suggestions for our township? There is a few events coming up. One is the Wheels of Wayne event, the April 24th. I believe that's this Sunday. Is that correct? And another one is the Valley Forge Military Academy. There's going to be a college health fair on a Friday, May 6th. And I believe that one is, there it is, from 12 to 2 at the Price Hall Gym. I don't think I'll be able to make that one, but I may be at Wheels of Wayne this weekend and might talk with Larry. Do we still have that sign we had last year? Or?
We still have it.
So maybe I'll be the one that does a little time there at Wheels of Wayne. And then there's a Maternity Care Coalition Carnival, actually, on Saturday, May 14th at Radnor Valley Country Club. That should also be a good opportunity to get in contact with people in the community. And I believe I don't have a time on that one here on my schedule. Hold on. Yeah, that one is 9 a.m. to 11 a.m. on Saturday, May 14th at Radnor Valley Country Club. Maternity care. So any other announcements anyone has? Or?
I just would like to tell the public and the board, even though I do believe I sent everyone an email, that I was invited into 3 hours of interviews for a public health officer. There were a group of us, and they were 3 very qualified candidates that it then moves to another level, and I'm not sure where it is at this point, and hopefully Larry will get the help he needs soon, or if they open it up again, however they're going to go about it. I'd love for the Board of Health to know where we are on that by next month, if you could, Mr. Taltone.
Make the inquiries.
Thank you, sir.
And seeing there's no public participation, we're going to wrap it up a little bit earlier today and adjourn the meeting and be back in this room on Monday, May 16th at 5:30 p.m. Thank you.